Today, I want us to work together in the process of a self-breast examination. The 5 minutes that you take monthly to examine your breast could be life-changing. Let's see how you go about the self-breast examination. We usually recommend that you do the self-breast examination for those ladies in the reproductive age 5 days after your menses. This is a time when your breasts are less sensitive and the hormonal effect is less. So to start the breast examination, you need to start in front of a mirror. And standing in a mirror, you put your hands over your hips and then you try to compress them tightly. So what you are looking for is you look at the position where the level of the nipples, are they at the same level? Is there any change in the position of the nipples? Is there any retraction or is there any inversion? You also check on the mirror on whether there is any color changes of the breast and is there any enlargement of any of the two breasts. And then after that, you can raise up your hands up and you do the same process where you look at the nipple, you look at the breast, you look at the skin of the breast, and you look whether there is any changes in the color and the positioning of the nipple. Then after that, then you place one of your hands behind your head and you use the opposite hand to examine the breast. You usually start on the far quadrant of the breast and you use the tips of the palms of your finger. You can use the 4 of them or you can use the 3 fingers, but you make sure this is the most sensitive part of the hand and is the one that you use. So you move your hand around the breast, trying to palpate all around the breast, and then you also can palpate up and down, moving up and down or through all the quadrants of the breast, and then you start again moving inside, outside, and inside, outside. After you finish one breast, then you also come to the nipple, try to press it and see whether there is any discharge. It could be watery or it could be blood. If you find any lump, you find any discharge on the breast, then you need to notify your health provider. Then you come to the other breast and you use the other hand to examine the breast. You start the same way. You go around the breast, then you can go up and down, and then inside out, all through the breast. And then you come to the nipple and check for any discharge. After you finish examining the breast, then it is always good that you also examine your axilla. And you examine your axilla with your hands folded so that you can be able to access the deepest part of the axilla and check for any swelling or lymph nodes or any pain. If you find any pain or you feel uncomfortable in any way, always check with your health provider. Remember that self-breast examination is not a recommended screening method. The gold standard for screening is the mammogram. But self-breast examination also helps to identify any abnormal changes that you may notice in your breast and seek help immediately. So for you to be able to maintain your breast health, please do monthly breast examination, preferably after your menses, and do it the correct way. And then you can also go for regular breast clinical exam by the health provider. They should be done yearly, and it helps to augment the self-breast examination. And of course, remember the yearly mammogram, which is the recommended screening method for breast cancer. So breast cancer is easily preventable, is easily treatable when detected early. So let's all share this information with our friends, our daughters, our mothers, our sisters, our wives, so that we take up this challenge and prevent unnecessary death of women from breast cancer. Thank you for watching. If you like this video, please share it with the people in your circles so that together we join hands to prevent breast cancer. For more information, please subscribe to our YouTube channel, Dr. Derito, or Wellness Health Services YouTube channel, and please subscribe and click on the bell to get more content as soon as we produce it. Please also follow us on Facebook, Twitter, TikTok, and all the other social media avenues. Thank you for watching.